Hello, students. Welcome again. Good morning. Today we are going to learn about antimetabolites, in that folic acid antagonists. So if you need to go through the video which I have given in the link, introduction to antimetabolites, before learning or seeing this video. So what is that video? I have given in the comment in the link section. Please go and check that video first before going to this. So antimetabolites under cancer treatment, under that folic acid antagonist. So what are the examples which we told? The one of the prominent drug is methotrexate. Methotrexate. In the previous video or lecture, we have learned they block the metabolic pathway. They are anti-metabolites. They have structural similarities. Structural similarity. The one of the prominent drug is methotrexate. A natural one is folic acid. Natural one is folic acid. Now, if you give numbering, this is pyridine nucleus. So let me show you what are the components. What are the components present in folic acid is 3 parts. So please here in this you can see up to here. This molecule is called as pyridine. This portion up to here is called as PABA. 3 components are present in folic acid. Number 1 is pyridine nucleus. That is nothing but pyrimidine and pyrazine structure. Pyrazine structure. Pyridine nucleus, PABA, that is para-aminobenzoic acid, and this is the portion of glutamic acid. Glutamic acid is amino acid which is dicarboxylic acid. Dicarboxylic, it is acidic amino acid because it has 2 carboxylic group in its structure and 1 amino group. Then amino group, 2 carboxylic groups are present. So glutamic acid, we call this amino acid as glutamic acid. There are 3 components. There are 3 components present in folic acid. This is the way of numbering. 1, 2, 3, 4. Next, we don't give the junctional carbon. So this doesn't obey aromatic property. They don't have hydrogens. So because of that, we don't give numbering the junctional carbon. Next, we move to next heteroatom 6, 7, 8. Then to this. And first we finish the ring. Then we go to side chain. Now, here if you can see the structural difference is that at 4th carbon of folic acid consists of carbonyl group, whereas the drug methotrexate consists of an amino group. At the same time, 10th portion, 10th nitrogen of folic acid consists of hydrogen as a substituent. Here there is a methyl group as a substituent. These are the structural differences between folic acid and methotrexate. Here also you can see it. It is pyridine portion. This is PABA portion, para-amino. See, benzoic acid. This is carboxylic part and this is amino group. But here methyl substituted will be present, PABA, and this is glutamic acid structure. So both of these structures will be similar. Now cancer cell will mistakenly take methotrexate. Again, we are telling that these drugs act by competitive mechanism. Then when there is a competitive antagonism, then which factor plays very important role? It is the concentration which plays very important role, because we are giving methotrexate high level, so cancer cell takes methotrexate. So now you can see it here. What is this molecule? Diamino-pteridine nucleus. That is, what is the difference? Here, fourth one, there is oxo group or keto group. You can call it as oxo if you want, oxo, or carbonyl group. Carbonyl group or keto group. Carbonyl group or keto group. So keto group you can call. Here is present, here there is amino group. These structural differences will make the molecule more basic in structure. So methyl group is also electron donating group, and this amine group is also electron donating group. And amines, as more amines are present, and there is also this pteridine nucleus. Now, the basicity of this molecule, that means methotrexate, is increased 1,000-folds than the folic acid. Now, because of this basicity increase, now methotrexate will go and bind to the enzyme necessary for metabolic process. Clear, please? Folic acid is less basic than methotrexate. Now, this methotrexate has more affinity towards that enzyme which causes metabolism. So this is what we want to tell you first. So this is competitive mechanism. So this is the what we are telling. The both ways. In previous slide we kept this as down, but you can see numbering. This nitrogen was here and this was here, and then amine group also came down. Both ways you can see it. And when you do it numbering here, 1, 2, 3, 4. This is the way of numbering. In that slide, what happened? We reversed pteridine nucleus. Even this PABA was attached at this position. Both are same. 5, 6, 7, 8, 9, and 10. So this is the structural difference between PABA, folic acid and methotrexate. Folic acid and methotrexate. So now you can see that these folic acid drugs are very, very good drugs. Very, very good drugs. They play very important role. Until the discovery of methotrexate, there was a difficulty in treatment of leukemia. Now, once the advent of methotrexate was happened, Leucovorin leukemia is almost controllable nowadays. And it is also used in children acute lymphatic leukemia. It is also used in solid tumors, choriocarcinoma, that is malignant tumor of uterus. Nowadays, this is increasing. And one more is that, you see, this methotrexate antidote also they discovered. Whenever you feel some side effects, you can give this drug Leucovorin, which decreases toxicity. There also one more antidote we will discuss that was found later. So this also, because of this discovery of Leucovorin, which is also called as folinic acid or cytophobic factor or N5-formyl FH4, then it has become very prominent drug in treatment of leukemiasis and solid tumors. And one more thing is that it blocks the two enzymes necessary. That is dihydrofolate reductase, and also it blocks folate dependent enzyme, that is thymidine kinase. because of that, where you get pyrimidines and purines. So indirect, that is indirect way of action. Methotrexate blocks dihydrofolate reductase directly, and it also blocks folate dependent enzyme, that is thymidine kinase, where there is a decreased production of pyrimidines, later purines, so there is no production of DNA. So this is the some of the properties of these folic acid derivatives. Properties of folic acid derivatives. I also told that because of this amine group at 4th position and 10th position, the basicity of this drug is increased such that it go and binds to the enzyme dihydrofolate reductase more than folic acid. Folic acid. First, let us learn the basic mechanism of synthesis of folic acid and their metabolism. Then you can learn easily the the methotrexate mechanism of action. See, the first one is that here you need to remember, see, if there is double bond here, it is called as pteridine molecule. It is called as pteridine. Because in our structure, the double bonds are removed. Removed. That's why we written dihydropteridine. Dihydropteridine, and there is a phosphate molecule, 2 phosphate molecules. That's why it is called as pyrophosphate. Pteridine nucleus, pyrophosphate. The numbering is from here 1, 2, 3, 4 here. 5, 6, 7, 8, 9. Pteridine pyrophosphate. This is combined with PABA. This is PABA, para-aminobenzoic acid. What is the enzyme necessary to link these? You see, dihydropteroate synthase, P silent. Here, the P silent, teroate, dihydropteroate synthase. So what happens is that the PABA is linked to this pteridine nucleus. That's why the name you see dihydropteroate. Dihydropteroate. The phosphate molecules have gone, then it is called as dihydropteroate. Now this dihydropteroate will combine with glutamic acid. Combines with glutamic acid. There is carboxylic group in PABA. There is amine group in glutamic acid. Because of this, there is a peptide bond. Peptide bond is formed. Peptide bond. What's the enzyme necessary here? Dihydropteroate synthase. So you are getting dihydrofolate or folic acid. Some textbooks write as folic acid or dihydrofolate. Folate means it has COO minus. If there is H, it is called as dihydrofolic acid. Dihydrofolate. We are writing in the short form. F, which means folic, and H2 means these are the hydrogens which is extra present. This is one hydrogen. This is one more hydrogen which was from the starting. F2. Then dihydrofolate. So till now we have seen the synthesis of folic acid. Now this folic acid gets metabolized to active molecule. Dihydrofolate is converted to tetrahydrofolate. You see one more double bond which is present between 5, 6, 7. Between 7, between 6 and 7 get reduced. So double bond is getting reduced here. What is the double bond? Between 6 and 7, it is getting reduced. So this is the double bond which is getting reduced here. So because of that, you see, there are 4 hydrogens now. So these use there already 2. Already 2 hydrogens. You see 1, 2, 3, and 4. That's why it is called as tetrahydrofolate, which is also called as FH4. FH4. Now, this is the active molecule, which involved in the synthesis of further pyrimidine nucleus. Now in this slide, you can see some of the drugs which can block here. So the first one is, so dihydrofolate synthase is blocked by sulfonamides. I also told in the previous video that sulfonamides are also antimetabolites. Now our drug, methotrexate, is blocking dihydrofolate reductase. One more drug you see, trimethoprim, the component of a cotrimoxazole. Cotrimoxazole consists of trimethoprim and sulfamethoxazole. So that also blocked. So this is the one which is blocking. Now further, let us see some more. In next slide, you'll get some clarity. Now what happens is that we told this FH4 is active molecule. Now FH4 will react with amino acid serine. And this serine, when it reacts, what happens? The methylene group which is present on serine will be transferred between 5th carbon and 10th nitrogen. 5th carbon and 10th nitrogen. 10th nitrogen, it is formed. This is a 10th nitrogen. So what is that? It is called N5N10 methylene FH4. N5N10 FH4. Now this is what? After getting this from serine, at the same time is converting into glycine. Here FH4 is converted to N5N10 methylene FH4. That means there is methylene group. There is methylene group between 5th and 10th nitrogen. Remaining portions are present. The pteridine nucleus and glutamic acid is present here. Now this glycine is very important for production of heme, porphyrins, purines derivatives. Now, further is there, please try to concentrate. Now you see in this slide, next slide, I'm bringing all the things in one slide in shortest form. So first, what we have seen, folic acid, it is reduced by dihydrofolate, it is converted to FH2. FH2 is converted to FH4 by dihydrofolate reductase. Now it is converted to N5N10 methylene by the help of serine, which we have seen in last slide, N5N10 methylene FH4. Now you can remember that our body does not produce, humans cannot produce folic acid. So our body will recycle the folic acid which is synthesized. So I told FH4 is active molecule. Now this FH4 is converted to N5N10 methylene FH4. During this, what happens is that this N5N10 methylene FH4 is converted back to FH2. At the same time, this will react with deoxyuridine monophosphate. Deoxyuridine monophosphate, this is the structure. Uracil derivative and ribose sugar and phosphate. So it has one phosphate. So deoxy, you see there is no hydroxyl group at the second position. This is uridine molecule. Uracil plus ribose sugar is called as uridine, and there is phosphate group here, deoxyuridine. Now here you can see it, the methylene portion which is present, the extra methylene portion, this is the N5N10 methylene portion which is present extra. Now this methyl group is transferred here onto this carbon. onto this carbon, onto the fifth carbon. And the fifth carbon, what is present? Hydrogen is present here. Now it is transferred to the fifth carbon, making this molecule as thymidine molecule. That is deoxythymidine monophosphate, which is important for pyrimidine nucleus. This is very important, which binds to adenosine of what is the DNA, one strand. AT will bind, guanine will bind to cytosine. Now, that's what. If you block this, there is no FH4. When there is no FH4, there is no formation of N5, N10 methylene FH4. At the same time, when there is no N5, N10, thymidine, deoxyridine monophosphate will not convert to thymidine monophosphate. There is no formation of purine, or what's that? Pyrimidine derivatives. So this is the metabolism and mechanism of action of these drugs. Now, see, the metabolism of methotrexate is that you can see it here. It breaks this peptide bond. Then you are getting this molecule DAMPA, which is called as diamino methylene teroic acid and glutamate. This is natural. And here you can see it. There is breakage between this carbon and nitrogen. Carbon and nitrogen, which results here carboxylic group metabolism, and here there is methyl group. These are also active molecules during the process of metabolism. Let us see some more. So in the body, what happens is that methotrexate is a very short-acting drug. Though it's a very excellent drug in the treatment of leukemias and solid tumors, lymphomas, but what's the disadvantage? It is short-acting. In the body, what happens is that there is abundant glutamic acid present in our body. So glutamic acids are added to the methotrexate molecule. So then if it is many are added, then it is called as methotrexate polyglutamate. What's the beauty of this methotrexate polyglutamate is that it is long acting. It can stay in our blood from weeks to months. So whereas methotrexate, the T-half is very, very small. Now in the body, what happens? Glutamates are added. Or we have marketed methotrexate polyglutamate, which can act for long period of time. This is methotrexate glutamate. Next one, you can see their uses. As we learned, it is very good drug, especially in cancer, leukemias. Apart from that, it's also used in autoimmune disease, psoriasis, rheumatoid arthritis, but carefully we have to use. It is also very good drug for ectopic pregnancy. That means pregnancy will happen not in the uterus, it happens in the fallopian tubule. So fallopian tubule cannot expand like uterus. The baby will grow as the months increases. So it's very dangerous condition to the woman. So that condition, it's used to remove that. So baby is nothing but it's like cancer cell you can consider. Now this drug, when you give all the replication process, what is occurring in the fallopian tubule will stop and get out from the body. So we have seen this used in psoriasis, rheumatoid arthritis, which we were telling about, autoimmune disease, leukemias, breast cancer, lung cancer. Very good. The side effects of these drugs are severe vomiting sensation you'll be getting. You can use ondansetron. They come in the form of strips, mouth dissolved strip. So immediately, as soon as you get place, it comes like our pH papers. If you put in mouth, it gets dissolved. So that skin rashes, very, very dangerous. Sometimes you can see redness, neck, total body, very dangerous. Mouth ulcers, sores, you will get. Then treatment, we can see it next slide. So this is so these are the drugs which, so this is the drug which we were telling, Leucovorin. It is Leucovorin, which is having again similar structure with that of folic acid, and also what is that? Methotrexate. What is difference here? In methotrexate, here we were having amino group, but here it is carbonyl group, just like folic acid. This it's here also just like folic acid. Now here formyl group is present. What is the group present here? Formyl group is present. What group is present? Formyl group is present. That's why it is called as N-formyl FH4. It is called as N-formyl FH4. Formyl derivative of folic acid is called as leucovorin. It has multiple names. It is also called in the name of folinic acid. It is also called in the name of folinic acid or cytoverum factor. As it looks similar to that, see all the double bonds are reduced. So we are calling it a derivative of FH4. The main use is it is used in treatment of methotrexate poisoning. How does it act? How it acts, you see. Now, leucovorin is called as rescue therapy. Whenever you are in dangerous, if anyone is helping, it is called as rescue plan. Now, methotrexate poisoning is so dangerous. So if you give this leucovorin, we are getting treated. Now, what happens is this leucovorin will convert to, in the body, this will be converted to N5N10 methylene FH4. This keto group, it will be converted to CH2. Reduction will occur. Clear? Let me tell again. In the body, leucovorin is converted to N5N10 methylene FH4, which I was telling. This is the metabolite which is responsible for recycling process. You can see in this diagram, N5N10 methylene FH4 is converted again to FH2. Is converted again to FH2. FH2 is converted to FH4. Again, N5N10. During this process, deoxyuridine monophosphate is converted to thymidine monophosphate. So because of conversion to N5N10 methylene FH4, the whatever purines, pyrimidines, and this cofactor is not present, our body will try to get those things. Will get those things. They have also found some more new antidotes, that is thymidine. So here also you can see what is the ultimate product? Thymidine. Now this thymidine is one which is going to form a complex with adenine molecule. There is that is also given as an antidote, and there is also glucarpidase. Glucarpidase. So how does this glucarpidase is that this is a drug which takes out that methotrexate from our body. It clears methotrexate from our body. Glucarpidase is a drug which binds to methotrexate and clears by the urine. And thymidine also is one of the important ones which protects from renal dysfunction. So these are the three drugs which are given in toxic effects of methotrexate. What are those drugs? Leucovorin, glucarpidase. Glucarpidase, how does it act? It acts by conjugating, just like phase 2 metabolism. It conjugates with that of methotrexate and gets out from the body by urine. and thymidine, which is protects from kidney damage and from cancer. So these are the three antidotes which they use. Now we are almost finished. So there are some more drugs which are similar to drugs, that is proltrexate and pemetrexate. So these are some of the new drugs which are folic acid derivatives. Folic acid derivatives. So these are the reference materials, just like same Foye, Giswold, and Patrick. Let us see some of the questions, and you can get some recollected. Which of the following drug is N5-formyl FH4? N5-FH4. We already told this. It is the leucovorin. Leucovorin is the drug which is called as this one. Formyl group. At which position? 5th position. There is a formyl group. This is formyl or aldehyde group. IUPAC name is called formic acid. No, normal name. Or methanaldehyde. We call methanaldehyde. This is the answer. Now, let us see. This is leucovorin, is the drug which is called as N-formyl FH4. You can see by the help of structure, which we discussed already. What is the target enzyme for methotrexate? Dihydrofolate reductase. Dihydrofolate reductase is the target which convert FH2 to FH4. That is the important step. Then FH4 will convert to N5 N10 methylene FH4. Which of the following drug is antidote for methotrexate poisoning? Sodium thio. What is that? You can see sodium thiosulfate. It's an antidote for what is that? Cisplatin. Folic acid, not folinic acid. What if we have given? Folic acid. Folic acid. Another one is leucovorin. Another is mesna. Mesna is antidote for cyclophosphamide. Purine is a metabolite. So among all these, the antidote for this is leucovorin. Leucovorin is the antidote. Antidote for methotrexate poisoning. Leucovorin is antidote for the methotrexate poisoning. We are almost coming to end. Next one, last question, I guess. Finish. So these are some of the questions. Do subscribe my channel. If you have any doubt, please message me. Thank you very much. Bye.